Good afternoon, everyone, and thank you for joining us in our Community of Learning Enrollment Specialist webinar today. My name is Kimberly Fowler, and I'm from the National Council of Urban Indian Health. We'll get started in just a few moments, but while you are waiting, if you could please provide your name and organization in the chat box, which is located in the bottom right-hand corner of your screen. Good afternoon. My name is Kimberly Fowler, and I'm the Director of Technical Assistance and Research here at the National Council of Urban Indian Health. Thank you for joining us today for this Enrollment Community of Learning webinar. I ask that if you haven't already done so, please provide your name and organization in the chat box located in the lower right side of the screen. All lines are currently muted. However, if you wish to ask a question, we ask that you hold them until the end of the presentation, when we will provide a time for Q&A. This community of learning is specifically geared towards assisters and navigators that are working on the ground in urban Indian communities to reach the uninsured. By providing you with relevant information and practical tips, NCLE aims to support you in being successful in your outreach activities. Today's community of learning will feature a presentation from one of our urban Indian health programs, Native Health, located in Phoenix, Arizona. They will be sharing with us on their best practices learned from implementing a Medicaid outreach and education grant. But first, before we hear from Native Health, I wanted to provide you with a few important dates and information as we proceed through this third open enrollment period, also known as OE3. As you are aware, OE3 has begun and runs through January 31st, during which the marketplace is open for consumers to learn of their options, enroll, and make changes to their current plans. Along with the ability to enroll and or make changes to the marketplace health insurance plans, the time to assist Medicare-eligible consumers in enrolling is also of essence. Medicare open enrollment began on October 15th and runs through December 7th. This is extremely important for those consumers that may need more appropriate Part B plan determinations, and your assistance may be needed at this point. I would also like to draw your attention to the upcoming HHS National Action Days of Action that are geared towards American Indians and Alaskan Natives, known as the Tribal Days of Action. During OE3 and these specific days, Secretary Burwell is asking that tribes, tribal organizations, and urbans host at least one enrollment event in their community. This week of November 16th marks the Native American Week of Action, and as you can see, there are several dates dedicated to urban locations during which HHS, the Indian Health Services, and the NEHO, National Indian Health and Outreach Education Partners, will be supporting community events and trainings. Please mark your calendars for these dates. More information can be found at the following websites that also contain downloadable American Indian Alaska Native specific brochures and pamphlets that can be printed for your use during your activities. Also, please make note of NCLE's newly redesigned Affordable Care Act dedicated website, urbanindianhealth.org, where you can locate current information as well as helpful tips and tools that have been used by other American Indian Alaska Native organizations. More information can be found at the following websites that also contain downloadable American Indian and Alaska Native specific brochures and pamphlets. So without further ado, now I would like to introduce today's presenter, Ms. Zepporah Fuller, who is the Medical Office Manager at the Native Health Clinic in Phoenix, Arizona. He supervises the Outreach and Enrollment Specialist as an Outreach and Enrollment Specialist, assists with program strategy, and specializes in the data evaluation of grant outcomes at Native Health. He has been at Native Health for 8 years and has worked in the healthcare field. As a reminder, we ask that you please hold your questions until the end of her presentation during the Q&A section. So without further ado, I'd like to turn it over to Ms. Fuller.
Good afternoon, participants. Thank you so much to Nikui for having me today, as well as allowing Native Health to provide information regarding our program. And just bear with me one moment here while I get my slides up. So today what we're going to go over is going to be just some outreach and enrollment tracking and retention strategies. And so what we're going to do is go ahead and give you a little bit of background information regarding our Native Health facilities, go over our grant goals, and of course go over our enrollment program, which is currently in the pilot stage. We do all of our tracking, auditing, and all of our calls within house. We do not outsource any of our tracking, auditing, or calls. We'll also touch on how our facility keeps contact information up to date, and then we'll go ahead and go into our enrollment approach, data tracking, and retention strategies. We'll also briefly go over our outreach program and end with our best practices and resources. So just a little bit about Native Health. Our mission is to provide holistic, patient-centered, culturally sensitive health and wellness services. Our vision is to have healthy people and healthy communities. Some of the services that we provide are primary medical care, dental care, behavioral health, WIC services, health promotion, and disease prevention. We also have a wellness division. We do have 3 locations within the metropolitan Phoenix area, which we've got one in downtown Phoenix, which is our headquarters, and we also have one in North Phoenix, which only provides medical services and is currently obtaining a dental health unit. And we also have one information and referral center, which is located in a shopping mall that actually assists with access, food stamps, TANF, and information services only. Our outreach enrollment services, we do have certified application counselors that are available at all of our locations, and they assist with access, which is the Arizona Medicaid, SNAP, TANF, and the health insurance marketplace. In addition to providing assistance in those areas, they also have expertise in Native American exemptions, so we also assist families during tax season to help them set up for those exemptions. They also do participate in presentations within the community, whether it's at Native American parent advisory committees or also just for schools as well. So what we'd like to go over now is just a little bit about our grants so that you're able to gain some knowledge of our grant goals. So our target population is children and youth ages 0 to 19. Our enrollment goals is we aim to enroll at least 2,000 Native American children, and that includes new enrollments or renewals. We also aim to contact at least 6,000 individuals, which is to provide education and materials. So we do not count those interactions, which are just providing a flyer and letting them know that we do have PACs on staff. It's an actual 5-minute, 5 to 10-minute conversation with individuals on a one-on-one basis, which we actually track as well. Our focus area is to engage schools in outreach, enrollment, and retention strategies. Currently, the grant is for 2 years, and we actually just ended our year 1 on November 12th. Our Phoenix metropolitan area includes Maricopa County, which has 24 cities and towns, and 5 American Indian Reservation communities. We do have 58 total school districts within the Maricopa County, and we do target the K through 12 grades. We also do have 4 universities and a handful of community colleges that help us to garner the 17 to 19 age population. To help with the evaluation of our strategies, we do include the following into a monthly report, which also does get included in our monthly report to our Board of Directors. Included in that is our enrollment and contact numbers, which is recorded on a month-to-month basis. We also focus on tracking our adult information as well to fine-tune our presence within their demographic. It's always a good idea to track possible future data just as long as it does not hinder your outreach enrollment specialist or navigator availability or job duties. In addition to that, we also capture new enrollment versus renewals. We also capture events attended with the number of attendees and on-site enrollments per event. And this portion is a critical piece of information which will allow you to notice trends and strategies that work and locations which have a high demand. So we'll go ahead and go into that strategy in just a moment. In addition to that, we also do touch on our successes and challenges for the month, which helps us to identify key elements of successful changes made in areas of opportunity. In addition to this, each team member submits their portion of what they've contributed to those monthly numbers, so they're able to see their individual productivity, and they also see how it contributes to the overall goal. The report gives them a chance to visually see the impact that they're making as individuals within the community, and also helps to establish the importance of their role. I found that this is a vital, key piece of practice to keep team members motivated. So now that you know about our practice and our grant, I do want to talk a little bit about the state of Arizona. We've been talking a lot about ACCESS lately, but what does ACCESS stand for? It is the Arizona Healthcare Cost and Containment System. Arizona is a Medicaid expansion state, and so this is the most recent data that I was able to pull from our access.gov website. Right now, it's estimated that among the 6,500,000 Arizona residents in 2013, approximately 309,000 were American Indian or Alaskan Natives. ACCESS has published 2015 population demographics to their website, in which you can see here in the July 2015 column, we do rank 3rd in state enrollment, and of the population, 9.33% of the 1,700,000 ACCESS population, actually of that, 162,000 are Native Americans. So we have had a slight decline from previous months, but that's what our grant is here for, is to establish and try and help increase those numbers. The state publishes the enrollment numbers on a quarterly basis, so I'm pretty sure that the October numbers should be coming out pretty soon. With Arizona, we actually also have an automatic renewal website, and this is actually the 2nd year it's been implemented. And what it is that it's a system in which the individuals are mailed the paperwork for the renewal, and it's populated with all of the previous year's information. So all they have to do is just mark on the change on the paper, the change of address, a change in income. Of course, that is required, but it's easier for them to send that on in from home. They are provided an envelope, so all they would have to pay is postage. On the website, there's a 2-line sentence there for the automatic renewals, which just states an ACCESS member must renew coverage at least once a year. You will be notified when it's time to renew. And of course, in addition to that, they have a link to report changes. Renewals are sent approximately 60 days prior to their insurance expiration. So what we like to do is keep our information up to date. So what we're going to now go over is going to be our enrollment program. And at this time, we're going to have a poll, which I'd like to gauge the team and see how you guys are tracking your data. So go ahead and just select the strategies that your practice currently has. And so you'll notice that the poll that popped up just says, if you have an enrollment strategy in place, how do you track your data? So you've got a data software option, you've got an online survey, an Excel spreadsheet, paper logs, other or not applicable. All right, thank you so much for your response. We'll go ahead and end the poll. It looks like the majority of participants marked others. And so I do want to just reflect on that and just try and help and provide some strategies regarding that portion. So with that being said, I do now want to go into our next slide, which is going to go over how we identify eligible individuals. We do have several sources within house. We utilize the RPMS system, which I'm sure some of you guys are familiar with. That's the Resource and Patient Management System. We utilize the Insurance Verification page. We also use the Healthy Arizona Plus system, which is the state Medicaid portal, and also the Health Insurance Marketplace portal as well. We also utilize in-house referrals at the patient or provider request. And we also accept outside referrals for individuals who do not have insurance. In addition to that, we also do utilize our outreach event scouting and contacts. Included in all of this information, it also should be noted we do have a community coordinator who helps us assist with the outreach event scheduling, which we'll also go into in just a moment. The biggest key piece that we found in the barriers that hinder individuals from enrolling is when they don't update their address or when they don't update any of their information, phone numbers. So what we like to do, and of course I'm sure many of you do this as well, is to ask the individuals every time contact is made, every time they call in to make an appointment with us. If our behavioral health department receives a call, they'll also update that information. So it's making sure that the message is consistent to keep contact information current. We also do have our outreach and enrollment staff update contact information in the HEA Plus system that we were able to identify individuals and contact them when we need. The next slide here does go over our strategies prior to July 2015. Prior to July 2015, our enrollments were tracked via survey, and that was through SurveyMonkey. There were no renewal or outreach data that were tracked at that time. Since then, the only data we tracked were new enrollments and data. We actually had to hand count this based on our CMS grant semi-annual progress report. So all of the data featured here was an actual audit, which is when we had to implement a system that helped us to organize all of our information. The only proactive approach that we had at that time was that the outreach and enrollment specialist team would receive insurance expiration notices from the front desk staff only. So we didn't have that home of having other referrals come in or having a proactive RPMS search. The team also did experience some staff turnover at the beginning of the grant implementation, which did result in the loss of some enrollment data and numbers. We have since been working with the HA Plus system to backtrack to see if we're able to pull that individual's numbers for our future reporting purposes. Again, the data here for the time period is noted, and that was from November 12, 2014 to June 30th, 2015. So that played a key piece as far as creating our tracking tool design. We did select our data based on our grant requirements as well as our HEA Plus system. So what we did is that it was important that we knew the limits of the HEA Plus system prior to our design process. The team had contacted the state to determine what reports they were able to generate to minimize our PHI exchange. Unfortunately, the system only allows to view applications within a set time frame, which is 60 days at a time. So most of the teams were relegated to producing their own tracking systems. We also did consider our multiple grants that we do have, and we did consider the HA Plus system and our evaluation plans listed in our grants before the design. We did narrow the criteria down to the most common and important data, which included the application ID numbers. As you'll notice here, we also included demographics just to track where a majority of our patients were coming from, and that's also used for clinic data in the addition to the grant. We also did start tracking renewal dates, and we're only able to obtain that once the application is approved. Here is an example of our tracking spreadsheet. You will notice all of the columns listed there do serve a purpose for our data tracking. The next slide here is going to walk us through how we use our tracking tool. So in this section, the application ID numbers are recorded in the application ID site, and then what we then do is we utilize that application ID to input into the HA Plus system, and you'll notice that there's a little arrow with a circle around it which states that the patient has been enrolled. So what we then do is we pull up the patient's information, and then we notice that it was a renewal, so we'll track that in our data spreadsheet as a renewal, and then we'll also look and see when the renewal date is. In this person's file, the renewal date is listed as September 30th, 2016. So what we then do is we record the renewal date for future outreach, and this produces our proactive approach. So the Outreach and Enrollment Specialist team reviews all of the renewal dates, which are usually at the end of the month, and what they do is they attempt 2 calls. They'll attempt call 1 about 60 days prior to the renewal date, and then call 2 about 30 days prior to the renewal date. Although the state sends their renewal notice about 60 days prior to the renewal date, we actually provide a second follow-up in the event the patient has not received the information from the state, or if they've changed addresses and have not notified the state, then we're able to capture them proactively in that way as well. Even if the team runs behind the state renewal notice, it does help us to reach the clients. Post-July 2015, after the reporting of our semi-annual report for the grant, we did establish this pilot program, which, as you'll notice, does track everything done within house. It does track our enrollments, our renewals, and also our outreach events, as well as the number of contacts that we're making at each event. So again, with the enrollment program, it has created that proactive approach and also promotes patient retention. Our approach also allows for flexibility and amendments. All of the teams are encouraged to provide feedback and any ideas that may either lessen the data that we're obtaining or help to make the data reliable. In our retention strategies listed here, we also do offer one-on-one patient-client education and awareness. This is offered during office visits or during appointment scheduling. So our medical appointment scheduler, when a patient calls in, does notify the team or the individual that they are due for eligibility renewal or insurance renewal. The physicians also reinforce the importance of having health insurance as well. We also offer health insurance workshops and events, which is always free to the community. We also have a Native Health newsletter and social media reminders, and we also do a lot of outreach. So I'd like to take another poll here and just see how many of you guys track your outreach that you do for your grants or for your facility. If you have an outreach strategy in place, how do you track your data? Again, do you use a data software system? Do you use an online survey? Do you use an Excel spreadsheet? Do you use paper logs? Do you use something else? Okay, so it looks like several of you use paper logs and others not applicable. So what we're going to do is hopefully provide you with some strategies to begin tracking your outreach numbers, because it is very imperative that you understand which events are conducive to your grants and which ones are beneficial to where you're providing health insurance enrollment to the community. So as mentioned before, we do utilize our communication coordinator, and she is the first point of contact for any organizations or any additional institutions that are looking for a partnership to either have our staff head out to their facilities to do volunteer work, or if it's to have some of their students come here to do some intern work. But she's the nurturer for all community coordination, as well as any partnerships with Native Health and the community. What we also do have is an outreach employee policy, and all of our staff are required to perform 8 hours of outreach per fiscal year. So an example of this is the annual Cherokee picnic was held this past Saturday, and our staff attended along with 1 to 2 volunteers that was a Native Health staff, but not an outreach enrollment specialist. They are required to perform both outreach enrollment specialist team also has developed new partnerships. We've actually added the Herd Museum to the list of our partnerships. We would head there every month for our First Friday, which is an arts and crafts fair that happens in the city of Phoenix it's the first Friday of each month. So we actually decided to head there, and they're the local American Indian Museum. So we were actually able to capture additional families that were visiting for First Friday. We also have included a school lunch program as well. So we have reached out to those schools, and they were able to provide a list of their students who were on a lunch program. Then we were able to reach out to them and have them speak to one of our outreach and enrollment specialists to enroll into a health insurance program. So with all of us attending so many different events, we felt the need to create a tracking spreadsheet. So what we did is anytime we presented or tabled at an event, what our team did is, again, engage in that one-on-one contact with individuals and spent at least 5 minutes with each person. So what we decided to do is ask the individuals if they knew of the renewal date. This also helps the individuals become consumers and provide that accountability to where if they didn't know when their renewal date was, they were able to go into their file or sit down with our outreach enrollment specialist to mark when the renewal date was. We also did include the first name, last name, a phone number, and an email address so that our team was able to contact them in the event on-site enrollment was not available. We also did list a contacted by sheet here, or column. That way we wanted to hold our team accountable to ensure that our team was effectively reaching out to individuals. Sometimes the individuals may get missed in the event there's no contacted by column. It also just identifies individuals who are in need of additional assistance. Our biggest outreach strategy is to keep a consistent presence within the community. We do engage a lot of the schools that I've mentioned before, and they do produce a lot of families and a lot of different communities and resources that are in need, populations are in need of our team and our services. We also do attend health and resource fairs and community events. So we, again, have an outreach enrollment specialist team member in addition to a Native Health staff member performing their outreach hours. They also attend these powwows that we host, and powwow season is coming up. So we actually, again, proactively set up any sort of on-site enrollment expectations for the organizations. We let the organizers know that we do have those capabilities, and we leave it up to the organization or the institution who is hosting to have them get the word out to the community that we will be providing on-site enrollment, and we provide the flyers with the information needed from individuals to actually begin enrolling into a health insurance plan that day. We also do have weekly and monthly assistance that we provide at partnering facilities. We have a unspoken contract, I should say an unofficial contract with UMOM, which is a domestic violence shelter here in town. They actually have us come out to their facility and enroll their families, moms and children, so that also helps as well. Next up is just a list of some of the partnerships that we currently have, and you'll notice again a lot of them are with community colleges and schools. Some of the best practices and some resources that have helped us to shape and form our pilot program include the use of multiple strategies that allow for flexibility. You always want to create strategies that you can tweak, as well as strategies that others can provide input. Creating that team buy-in is very essential. When employees and staff feel like they're contributing, they are more apt to contribute or output. We also do have consistent training for new hires and all staff. Being that we do have 3 different locations, it is easy to have a location start doing things one way and then another do it another way. We'd actually streamline the process to where all of the enrollments that are occurring are happening the exact same way at all of our facilities, and that each facility is using the same spreadsheet. So it does help to streamline. We also do provide the monthly individual and team goals. Again, presenting your staff with their individual team goals is very, very helpful because they know what they need to do as an individual and as a team. We also do provide diligent weekly evaluation of data. If you have the time, a lot of individuals do state that they don't have the time to look through their data, but if you are going to be reactive in your approach, you're going to have that data begin piling up to where it's going to become overwhelming. So it's aside maybe an hour a week if you can to filter and comb through your data and get it organized. Also offer on-site enrollment. Although a lot of the outreach strategies, many people do head to these events, but what they don't do is they don't ask if they are able to enroll on-site. That's been our biggest key help. We also do the best practice that we've had with building collaborations and partnerships with local organizations. Everything that we do is within the local metropolitan Phoenix area. So another key element here was finding out what other organizations need and then presenting them with how you can help is always a good collaboration. Also the development of a community advisory committee. We have a parent advisory committee that provides feedback to our team. So we're able to include teenagers as well, youth who are able to provide feedback on some of our memes that we have or some of the presentations. We try and make sure that it's parent-friendly and kid-friendly, so having them included into your advisory group is also very helpful. You also want to make sure that you nurture your strengths. If your biggest strength is building partnerships, keep on doing that. Keep nurturing your strengths so that way you're able to build those partnerships again. You never know who might need your help until you ask. Also, the biggest help in addition to that is recruiting the right staff. So with that comes looking for people who are passionate. It has been our experience that when you cross-train or have that phone interview with individuals and kind of see where they want to go in the future, that's also been a big change in our hiring process, is really screening individuals to see where their passion lies. And our team, we've been blessed with such an amazing outreach and enrollment specialist team. Each of the individuals are very passionate about what they do, and they're so great at what they do. We also want to notice that fostering a teamwork environment is super, super, super key and super important. You also have to let your staff know how much you appreciate them. That way they're able to produce for you and help you reach your grant goals and provide quality services to your community. here's a list of the resources and materials that we've used that have, again, helped shape our pilot program. The CMS team has created customized Medicaid flyers that are specific to the American Indian, Alaskan Native population. So here's just a list of some of the new resources that have come up. The Medicaid Estate Recovery Rules and Protections brochures has been included, and an Indian exemption fact sheet. There are some website links here through CMS as well, so that you're able to head there and obtain more ideas. Some other websites that were also beneficial would be healthcare.gov for tribal info, partnerships through CMS for the materials, healthcare.gov to apply. Trainings and webinars are also available to you if you need it. Aside from that, that is our pilot program currently, and we are in the works of adjusting, making sure that we're fine-tuning our process. So we hope that in time we're able to create a system that allows us to reach our goals and as well capture important data. So thank you, Zepporah, for that very informative presentation that you just gave to us on some of the strategies that you've used in implementing that new Medicaid grant that you've had over the last year. At this time, I would like to open it up for Q&A. In doing so,
the conference is no longer in lecture mode.
We're going to ask that you mute your line by pressing *6 if you currently do not have a question. If you do have a question, please
the conference is in lecture mode.
Please go ahead and write it into the chat box so that we can then unmute the line for you to ask your question. Again, if you have a question, please write into the chat box so that we can unmute your line. Currently, there aren't any questions, but if you do have any questions, please feel free to write into that chat box. At this time, I would just like to thank Zepporah and Native Health for their participation on this Enrollment Community of Learning webinar and for providing all of the information on how they were able to implement those best practices that they learned over the last course of the year. I think there were some really informative strategies such as using the employee policies in order to help with your volunteering for your outreach and enrollment that I think that everyone could utilize for their own organizations. I would like to add that the slide deck is available for download